I've had this for a few years.
This will be followed by a physical examination.
And basically it gets aggravated the longer I stand or the longer I sit still.
When we see these patients, it's important to examine them to see the location of the pain and whether there's any muscle spasms in the area and how much flexibility there is in the joint. So we ask them to bend forward and bend backwards and so on. Now then we also want to examine them neurologically to see whether there's any nerve compromise. And so after examination, we usually would want some radiological investigations. Here we see that to start off with, we usually request for a plain X-ray. And with the plain X-ray, we will be able to see whether there are any degenerative changes to the bone. And also we'll be able to see how big is the gap between the vertebrae. Now then with this, then we'll be able to give some idea as to whether the disc has prolapse or not. But in a lot of the situations, we may not be able to because the plain X-ray would only show the bone structure. So sometimes, if the condition is severe, then we may well need to do a more detailed investigation like an MRI. An MRI will be able to see the soft tissues, including the disc and the nerve. And with this, we will be able to assess to the severity of the prolapse to the disc. When we do an MRI, you can see that the MRI here, that in a normal situation, the disc looks like this, where we see the nucleus annulosus, the annulosus here, and the nucleus pulposus here. Here we see it as a bright spot surrounded by a dark rim capsule here. These are the bones of the vertebrae. In this situation here, this disc is diseased in that it is dried. One cannot see the actual bright nucleus pulposus already and is herniated out. And this results in the disc material protruding out into this canal, resulting in nerve compression here. Now then, some patients may get pain to the buttock area. Sometimes it may be to one side, sometimes it may be to both sides. And again, we see that more MRI pictures of the condition in that the disc is pressing against the nerve here. And in this situation here, the disc material has traveled upwards to almost to the next level. So MRI does play a very significant role into helping us to make the diagnosis and to assess the severity of the problem.
Through physical therapy, David learned habits and principles that helped him to work on strengthening the back, neck, and core muscles.
The physiotherapy treatments were mainly focused on, firstly, they were to reduce inflammation. So I had some ultrasound therapy, which basically relaxed the muscle and tried to reduce the inflammation so that the initial symptoms would go away. After that, I went for classes every week, which focused on strengthening my core muscles, which would take some of the weight away from my spine. So it's basically helping me with my posture. And yeah, it's helped a lot. And basically now I can function pretty normally, about the same as before my injury. So things are getting better, but I just hope they won't get worse.
Yoga has consistently been used to cure and prevent joint pain by enhancing strength and flexibility. Stress can lead to muscle tension and back problems. Back pain can also come as a result of tight hamstrings and weak abdominal muscles. Adopting a therapeutic regime like yoga can help ease the pain. But if done wrongly, it can worsen the injury to the joints.
I think yoga certainly would help in that yoga essentially helps to maintain the flexibility of the joints, and that will maintain the range of motion of the neck. So these are some of the exercises the patients can do in order to strengthen the neck muscles. Now, by pushing the head against resistance, either in a forward motion or a backward motion or side-to-side motion. By building up strong muscles around the neck, that will reduce the force going through the spine and hence reduce the likelihood of spondylosis. Symptoms persist, then one may need to remove the mechanical component by doing an operation. This operation is known as fenestration and discectomy. Fenestration means making a small window through the back, and then once we're there, we then remove the part of the disc that is pressing against the nerve root. Here we see that this is the MRI, and this patient had this piece of the disc material removed during the operation. Now, then this operation usually would take about 2 hours to perform, and that the patient more or less can walk the next day, but usually most patients will stay maybe an extra day before they are being discharged from the hospital. The neck pain is also very common, and that the similar process also occurs in the case of the back. In the case of the back, one may see young patients coming to see us with neck pain, and that they will have, in addition to neck pain, they may also get pain and numbness radiating to the upper limb being the outer part of the arm and the forearm. And that they may, in addition to pain, they may also suffer from numbness.
Treatments for neck and back pain are very similar. For long-term relief, lifestyle changes must be undertaken. Exercise maintains muscle tone to strengthen the spine and keep it flexible. Like any fine piece of machinery, maintain the spine and it will give us good service and perform for many, many years.